My name's Dorothy Salmon, and I've been a proud member of the Rotary Club of Napa for 32 years. In fact, this year we celebrated our 100th anniversary as a Rotary Club, and I was very proud to be the first woman president of this Rotary Club. As we all recognize what service above self means, this is in particularly important as we help our veterans. I became involved with my Rotary Club's big event, Cycle for Sight, Rotary Ride for Veterans. I began 13 years ago by being the volunteer that raised my hand to bring coffee and donuts to all the folks that were registering 2,000 cyclists in the morning in Napa Valley for our amazing event. In the process, since we were raising money to help veterans struggling with post-traumatic stress and a wonderful program for blind campers, I became very involved with the program Pathway Home to help these veterans who were struggling to come back from combat with post-traumatic stress and really having a difficult time readjusting from the military to civilian life. I became so involved that I became a board member of the Pathway Home and eventually the president of the board of the Pathway Home. In the process of helping these veterans really adjust to a very difficult community readjustment from military to civilian life, I became very involved with the VA because the VA was the partner for the Pathway Home and all of the work that we did. In the process, I became fascinated with the VA and the fact that they do integrative health care, which is very unique. All of us civilians don't get that kind of integrated health care that is so valuable for the VA. In the process, we were successful. The Pathway Home was a wonderful program, but in 2018, we had a tragedy that was almost unbelievable. 3 of our beautiful clinicians were killed. And at that point, we had to make a serious decision. What do we do? Do we just give up? Do we let something this negative be our story? Or do we continue in memory of these 3 remarkable women and their dedication to veterans? That's at the point where we said we will do a guidebook to help other Rotary clubs learn what we've learned and what a privilege it is to help these veterans. So the guidebook is yours, free. The thumb drive goes to your club. Our district governor has been given 1 guidebook so he can show it off, and a lot of thumb drives so that it's yours free from us to you. For all of the Rotarians over the years who've said to all of us, I'd love to help, but I need that roadmap. We've produced the roadmap for you. And in the process, we're hoping that the legacy of the Pathway Home and the 3 remarkable women who dedicated their lives to that program and to veterans will live on through you. And all of the Rotary clubs in our area have been a partner with us. The Sunrise Rotary Club, the North Napa Rotary Club, the Kiwanis Club, the Sunrise Club in Marin, the Pacifica Rotary Club, the Brentwood Rotary Club. A myriad of Rotary clubs have been there throughout the years helping us, along with many businesses that have stepped up to the plate to be there, not only helping us raise funds for the Pathway Home, and now the post-deployment assessment treatment program at the Martinez VA, which is a sister program to the Pathway Home and remarkable. We need more programs like this across the United States. And for all of you watching this, since all of our Rotary members now have Zoom Rotary meetings because of COVID, for all of you out there, we want you to know that every Rotarian who's helped the Pathway Home and the PDAP program, we've gotten so much more out of it than we've ever given. And the VA really appreciates all of us, all of the Rotarians who can do what to us is very simple and wonderful gifts. Taking these guys fishing, going bowling with them, going hiking with them, being there for them, introducing them to our myriad of contacts that the VA doesn't have from a business sense. So you too can make a huge difference in the lives of these veterans. And we're going to make it easy for you because you've now got a roadmap and a guidebook. And now I'm very pleased to introduce you to Suzanne Gordon and Brett Copeland from the Veterans Healthcare Policy Institute. They'll tell you more about the veterans' healthcare and how you can be a partner to all the work that we've done. We're so proud of you for listening to us. Have a wonderful Rotary meeting, even if it's a Zoom meeting, and stay healthy and stand up for our veterans. They need you and we need them. Thanks a lot.
I'm Brett Copeland, Executive Director of the Veterans Healthcare Policy Institute. The Veterans Healthcare Policy Institute was founded by a group of veterans, healthcare providers and researchers, and journalists to educate, analyze, and promote the best healthcare programs and practices for America's military veterans. VHPI is a 501c3 nonprofit relied upon by veterans, healthcare policymakers, and administrators for our analysis and investigations into the programs and care delivery systems that provide healthcare to veterans. Too often, veterans and their healthcare needs are poorly understood by physicians, lawmakers, and the media. To combat misconceptions about veterans and their care, VHPI has produced guides, seminars, forums, and conducted an outreach to communities where veterans are underserved. In 2020, we committed to reaching veterans where they are, so we can better help them understand their care options. That includes communities that have been devastated by rural hospital closures, massive job losses from the pandemic, and places where private, not-for-profit hospitals are overburdened. Luckily, many veterans have access to the largest and only truly integrated care network in the U.S., the Department of Veterans Affairs Veterans Health Administration. Studies from leading medical research organizations, like the RAND Corporation, have found that VA provides equal, if not superior care compared to the private sector. As the long-term impact of the coronavirus continues to become clear, it's apparent that the Veterans Health Administration must be strengthened so that veterans have an accessible and affordable place to go for their care. VHPI also connects to the local media, which we've done through our state-by-state media briefings and through our Reporter's Guide to Veterans Healthcare. Too often, the media lack the context needed to tell the full story of veterans' chronic health conditions and effective mental health treatments. Stories often focus on the outcomes, the number of suicides, the failures of local and federal officials to maintain veteran home facilities, for example, but never get to the root cause of those issues. Through VHPI's work and through advocacy of organizations like the Rotary Club, we can not only shed light on failures in veterans' care, but prevent tragedies that we read about too often. Civilians who are unfamiliar with military culture, whether it's philanthropic organizations like Rotary International or doctors who provide care, they truly want to care for veterans. Unfortunately, they're unaware of why veterans are a unique patient population, which in turn creates barriers for delivering effective care rather than breaking them down. In the era of the pandemic, understanding what makes veterans such a high-risk group vulnerable to COVID-19's health and economic impacts is vital to ensuring they continue to get the care and support they need. The Veterans Healthcare Policy Institute thanks Rotarians who show their commitment through their volunteer work and financial contributions to veterans in their community. Helping veterans in your community is worthy work, and we're grateful for Rotary clubs around the nation for showing the commitment to serving those who served in uniform. But as you know, the wounds of war are not easily healed. Before you engage veterans, you need to know what works, particularly when interacting with veterans whose service have left them with chronic conditions like PTSD, traumatic brain injury, and physical ailments. Luckily, the VA, although not perfect, is America's leading expert in veterans healthcare. By partnering with your local VA, you can ensure that your volunteering benefits the veterans in your community. Additionally, you can help fund evidence-based and effective treatment by donating directly to the Department of Veterans Affairs. This completely tax-deductible donation goes straight to veterans because there is no overhead cost associated like there is associated with most nonprofits. Suzanne Gordon, one of our VHPI's senior policy analysts, is going to talk more about VA's unique programs and how you can work with them to serve veterans at your community. Thank you.
Thank you so much for having me here today to join with Dorothy Salmon and Brett Copeland to talk to you about how Rotary clubs can help veterans by partnering with the VA. My name is Suzanne Gordon, and I'm a journalist and healthcare researcher. I'm senior policy analyst at the Veterans Healthcare Policy Institute, and I've been writing about healthcare and veterans healthcare for almost 35 years. I've been really excited to partner with the Rotary Club of Napa and other Rotary clubs in California to establish a really exciting partnership with the Department of Veterans Affairs, notably at the Martinez VA, where the Rotary clubs have worked to support an exciting program called the Post-Deployment Assistant Treatment Program, which helps Iraq and Afghanistan vets who have PTSD, chronic pain, mild traumatic brain injury. And this partnership has really been innovative and exciting. And I've been really honored to work with the Rotary Club of Napa and other Rotary clubs in the area to produce a guidebook that will help Rotary Club members understand how they can help veterans by partnering with the Department of Veterans Affairs facilities in their locality. The Department of Veterans Affairs is the second largest department in our federal government after the Department of Defense. It is made up of three primary sub-agencies: the Veterans Health Administration, which has about 300,000 employees and delivers health care to some 9 million veterans. The Veterans Health Administration is the largest research powerhouse in healthcare in the country and has innovated in research that helps not only veterans but all Americans. I have the VHA to thank for my shingles vaccine. Folks who have pacemakers have it to thank for the first implantable cardiac pacemaker. The VA also teaches 70% of American physicians in trainings. In training, many psychologists, nurses, physical therapists, occupational therapists, you name it, the VA is at the center of healthcare education training in this country. The VA, obviously, its first mission is to deliver clinical care to veterans, and the VA delivers high quality clinical care at lower cost than the private sector. In fact, studies show that the VA excels over the private sector in everything from end-of-life care, treating veterans' emotional problems like PTSD, military sexual trauma, depression, anxiety, and so forth. The VA has arguably the most functioning mental health system in the United States, and the VA is really the only healthcare system that delivers integrated, coordinated care across the nation. It's not only integrated because a veteran can go from Boston to San Francisco and have their electronic medical record follow them. It's integrated because on a particular unit, mental health and primary care are integrated. The VA delivers homelessness services to veterans, legal services, employment services. It really is what we call in healthcare a population health system that deals with what we call social determinants of health, and that means it moves way beyond the delivery of episodic fragmented treatments to people to really delivering coordinated care. And that's why it's outcomes in everything from cancer care to post-traumatic stress disorder to managing chronic conditions like Agent Orange related diabetes and burn pit related asthma are so critical. It's why it has dealt with the veteran opioid crisis so much more effectively than a private sector institution could. It's why it deals with veterans' chronic pain more effectively. And that's what the Rotary clubs in Napa discovered when they began this partnership with the PDAT program. They discovered that if you really want to help veterans, the best way is to partner with a healthcare system that specializes in veterans' complex health and emotional and social problems. And you know, a lot of people will say, and they've said to us when Dorothy Salmon and I have done uh, um, workshops and meetings at Rotary clubs, people say, well, wait a minute, why do I need to partner with and give money and time and energy and donate items to the Department of Veterans Affairs? After all, we contribute to the VA with our taxes. Well, it's a really good question, and I'm very happy to answer it. And the reason is because the VA budget, the budget that we all contributed when we pay our taxes every year, that goes to clinical staff, to infrastructure improvements, to operating costs, paying for medical equipment and pharmaceuticals. It doesn't go to things like taking a veteran hiking or helping a veteran partner with an employer, or teaching a veteran how to beef up on their resume writing skills, or how to conduct a job interview, or how to make a network in their community. And that's why Rotary clubs are so important, because in donating time, money, skill, items to the VA, which we explain how to do in our Rotary Club Veteran Guidebook, you can really enhance the VA's ability to help veterans. And that's exactly what the Rotary clubs in Napa and Northern California have done. They have given money, and all the money that they gave is tax deductible. And all the money that you give is targeted to a specific program that you target if you so choose, or you could give money to the VA and they can assign the dollars to different programs. But every single dollar that you give to the VA goes to helping veterans. It doesn't go to overhead, doesn't go to CEO salaries, doesn't go to fancy galas and so forth. It goes right to veterans. And you can donate, and we explain just how in this guidebook. You can donate money, you can donate time and skill, and you can donate items, and we explain precisely how to do that. Let me give you an example. The PDAT program, through its generous contributions of donors and wonderful events like Cycle for Sight, has raised thousands of dollars that it's given to the PDAT program, which the program has used to help veterans find lodging and to help them, for example, if they need to repair a car, or if they suddenly need something. It's given items. The PDAT program received a van that the Pathway Home used to use and can no longer use since the program closed. Items have been donated, and most importantly, the Rotary clubs have donated time and expertise. Rotary Club members have taken veterans hiking, they've gone bowling, they've sat with veterans and helped them hone their skills in their study skills, their resume writing skills. They've helped them learn how to manage their finances. Remember, people who go into the military and serve for many years, they live in a world where everything is decided for them. And they end up not knowing when they leave how to manage their money, how to save, how to invest, how to do a simple thing like writing a resume, conducting an interview. In the military, you don't have to interview you for a job, you're assigned to it. And so these are things that Rotary Club members are perfectly positioned to do to help veterans when they navigate this complex transition from military to civilian life. Rotary Club members have helped take veterans on activities that help them make this transition. And the PDAT program is only one of hundreds of programs that the VA has all over the country. that help veterans in need in numerous ways. Let me give you a couple of examples. There is the Aspire Center in San Diego, which is geared to helping Iraq and Afghanistan veterans prevent homelessness. There's the Aurora Center in Connecticut, which helps low-income veterans and homeless veterans with getting primary care, getting housing. In fact, the VA basically has participated in efforts that have really completely eradicated homelessness, not just veteran homelessness, in the state of Connecticut. And they've reduced veteran homelessness all over the country. The VA has legal assistance programs to help veterans who get into trouble with law enforcement. And these are just a few of the many programs that the VA has. The VA teaches veterans how to cook. It teaches them how to ride bicycles. It teaches them how to repair the bicycles that they then ride. And it does this by partnering with groups in the community as well as in programs that are run exclusively by the VA itself. This guidebook that we've produced not only shows you how you can volunteer and how to get involved in this way, but it also gives some help in learning how to deal with veterans, particularly vulnerable veterans, because you can't just pop in and say, okay, so tell me your life story, because if you're dealing with a veteran who has PTSD, the last thing that you want to do is get them to tell their stories. That's a therapist's job, not a volunteer's job. Rotary Club members are really perfectly poised to develop these kinds of partnerships. They're leaders in their communities. Many of them are veterans themselves. And we really hope that you'll read this guidebook and that you'll learn from this one example of how Rotary clubs have begun a partnership that has really made a huge impact on a number of veterans. And in this case, it's a small number of veterans, but they're Rotary Club members in every corner of America. And if you can imagine multiplying their power, their influence, and their leadership so many times more, we can make a huge dent in the problems that veterans have as they serve their country. We can learn better how to serve them. So thank you so much for inviting me. I've been so honored to work with Rotary clubs in Northern California to produce this guidebook and to continue to help the VA help veterans.